Good morning and welcome back to Wellness Wednesday. I want to first start off by thanking our Wellness Wednesday sponsors, Daiichi Sankyo, Epigenomics, Genentech, Lilly Oncology, Merck, No Shave November, Quicken Loans, Taiho Oncology, and Turtle Beach. Today, Dr. Sophie Balzora joins us for a discussion on health equity. Thank you for joining us and welcome.
Hello, my name is Dr. Sophie Balzora. I am a gastroenterologist at NYU Langone Health, and I'm also a clinical associate professor of medicine at the NYU Grossman School of Medicine. I've been asked on behalf of Fight CRC to talk about health and healthcare disparities, health equity, and how we as patients, as patient advocates, and physicians and healthcare providers can close the gap on health disparities, particularly as it relates to colorectal cancer. Now, I'm not really, one who does these things very often, so a little bit uncomfortable in front of the camera, so I appreciate your time and understanding with that too. So first, I'm going to kind of go through some questions that we've laid out that'll help set the stage in terms of what, we're going to discuss during the next 5 to 10 minutes. So first, defining health equity. What does it mean when we talk about health equity? Basically, if you look at the cdc.gov's website, when they define health equity, they say that health equity is when a person can achieve its full health potential, right? So they're the healthiest that they can be. Unfortunately, there are many health inequities when it relates to health and health care. And this brings us to things like social determinants of health. I don't know if anybody has heard that term before, probably a lot of people who are tuning in today, but in the population at large, it might be a new concept. Social determinants of health refer to things that influence a person's ability to achieve that full potential of health. Basically, things like housing, things like employment, income level, the environment, right? The air we breathe, the water we drink, education, and what opportunities we have for education, all play into social determinants of health. So when we think about things like, the Flint water crisis, for instance, that is a social and public health crisis, and it has huge implications on patients' health, both from infancy to adulthood and the elderly. So a problem like that can certainly cause a lot of health inequities down the line. So what can we do as communities, right? What can we do to help close the gap on these health and healthcare inequities? I wanted to show you a little picture that summarizes what health equity means quite well. Give me 1 second. I love this cartoon because it's so simple that in terms of how it breaks things down and what things are considered equal versus equitable, right? Because they are two very different concepts. For instance, okay, I think you may have seen this before. When we talk about inequities, right, you see how this tree is leaning towards this child and leaning away from this child. Clearly, it's unequal, right? You can see that it's much easier for this child to get the apple than it is for this one. And he wonders, what's going on there, right? When we think about equality, we give both of the children ladders that are of the same height. This really doesn't fix the problem because this child can still get the apples much more easily than this child. So this is what we talk about when we talk about equality, right? Things are equal. They're equal. They're tools that are, distributed equally amongst the two children, but it doesn't close the gap on equity. Here, this is where equity does its work. You see here the ladder for this child where the tree is bent away from him. Much easier to get the apple now. This child doesn't need as tall of a ladder because he already has the advantage of the tree leaning towards him. This is what we're talking about when we're talking about health equity. And then finally, justice, right? Justice, now look at the tree. The tree is the problem. Now it's equal on both sides. It's not leaning towards one side versus another side. This is what we always aim to get to. But this is, these are the things that we're working on now in terms of, addressing health and healthcare disparities and research and the like in order to hopefully eventually achieve this one day. But when we're talking about health equity, we're talking about this. We're not talking about this. So, cartoons, I love them because they're super easy to understand. They have nice pictures, and I always see examples like this when we're talking about health disparities, health equity, and health equality. So I think that is a really great place to start. So giving real-time examples, right, of health and healthcare inequities. Look at COVID-19, right? Before we dive into colorectal cancer, think about COVID-19 and what's happening. So of course the whole nation is affected, right? There have been so many deaths, a lot of which may have been preventable. But what we're also seeing is patients who are African American, patients who are of Native American descent, patients who are Hispanic have the highest rates of transmission. Not only do they have the highest rates of transmission, but actually the highest mortality as well, particularly with our African American patients. And when we look at why this is, we go back to the whole idea of social determinants of health, right? People living in urban areas, more crowded areas, people who are deemed essential workers who had to travel to work during the height of the pandemic, depending on your location. All of those things increase the risk of transmission. So when we think about housing, when we think about, when we think about employment, those things have a heavy hand in determining the health and healthcare of a community. So seeing that, this exists, it's something that's so important to address. And given the times, right, there's no better time to do it. The times that we're in is what I mean, is that there's no better time to do it. So going to the next question now, how to get others to see the importance of the topic, right? So I think that a lot of us, particularly healthcare providers, really strive to have all of our patients reach that full potential of health. And that's where the importance is, particularly as it relates to colorectal cancer. I think a lot of people watching this video may understand this, but the public at large doesn't realize that there are huge disparities with colorectal cancer. For instance, with the Katie Couric effect, where she had her colonoscopy televised, the rates of colorectal cancer screening really skyrocketed, right? It was deemed the Katie Couric effect because it was so successful. But there were still disparities that existed in our white patients. There was a much higher screening rates compared to African American patients, Native American patients, and Hispanic patients. So the gap did close somewhat, but the gap did was less wide, I should say, but it certainly wasn't closed. What we see now is African American patients and Native American patients have the highest incidence of colorectal cancer. Our Hispanic patients have lower screening rates than white patients and African American patients. And African American patients have the highest mortality from colorectal cancer. They're diagnosed at later stages of the disease as well. When patients are diagnosed at advanced stages, the chance of survival is obviously much less. So this is why this is important as it relates to colorectal cancer, right? We really need to address these disparities. And how can we do that? So another question that I want to address is, different ways that we can engage communities to care about health equity and to address health equity head on. There are federally funded programs that target certain medically underserved communities, right? Be it through non-invasive screening options, low or no cost screening colonoscopies, and also raising awareness about the fact that colorectal cancer screening exists, that colorectal cancer oftentimes doesn't present with symptoms, and that colorectal cancer generally is highly preventable in most patients. So whether that's going to where the people are, right? Whether it's going to churches, whether it's going to barbershops, whether it's arranging community events that are centered around families to help raise awareness, are all things that can be done on a community level to engage the community with community and outreach based research or community and outreach events that help people understand why it's so important to get screened and why these health inequities exist and how we can potentially address them. So now moving on, how can patients make a difference when it comes to health equity, right? So like I said, making the public aware that these inequities even exist is a great start. Not only do we need to make patients aware and people aware that of the fact that they exist, but give them tools as to how to address it. I think that, it depends on, a lot of times people don't really think about these things until they personally go through them. But I think as a community at large, right, as a nation at large, we need to understand that when we address these health inequities and these social determinants of health, everybody wins, right? When we have these huge disparities, ultimately, it affects every individual American. So being a patient advocate, right? Working with Fight CRC, for instance, with Call on Congress is a great example of doing advocacy work as an individual patient. When you think about what individuals can do, what citizens can do, there really are so many things that go beyond, financially supporting different initiatives that help these underserved patients, but also advocacy work, right? Getting out and voting, right? Not just in presidential elections, but also local elections. There's so many different programs that allow individuals to get involved with advocacy on Capitol Hill or even at your local and regional level that we really should be taking advantage of. So some key initiatives to address disparities, right? For instance, we know that, again, a lot of people knowing this a lot of people seeing this clip would know this, but maybe not so much the general public, is that traditionally we start colorectal cancer screening at age 50. When we talk about screening, we're talking about patients who have no symptoms, right? Average risk colonoscopy for screening includes people who have no family history of colorectal cancer, don't have chronic digestive inflammatory conditions like Crohn's disease or ulcerative colitis, and they have no personal history of colorectal cancer or other cancer syndromes. So when we exclude these populations, we consider patients average risk. For patients of African descent, though, what has been changed in terms of the guidelines is to start screening earlier at age 45 instead of age 50. The hope here with decreasing the age at which colorectal cancer screening should begin in these at-risk individuals is the hope that we'll capture more patients who would otherwise be lost in the system and not get screened appropriately and then present with a later stage of disease, as I mentioned before. So decreasing the screening age to 45 is a key initiative that's been done and has been supported by the National Societies for Gastroenterology. Unfortunately, this hasn't necessarily trickled down to a lot of providers who normally would, tell patients to get screened. We know that one of the biggest factors in patients getting screened is having their doctor or whomever cares for them primarily tell them to be screened or encourage them to be screened. So when these guidelines aren't widely advertised, right, or people don't know about them, that's when we lose. So a key initiative that we really need to disseminate, right, and which we can do as individuals, is remind people that if you're of African descent, you should be screened at age 45. In addition to that, there are a lot of grants, right, that we hope can be supported, whether they're NIH grants or other grants by by the CDC and what have you, that really support patients who are Black, indigenous populations, and people of color, right, that I mentioned before, who are suffering from colorectal cancer at disparate rates. So like I said, bringing it back to Fight CRC, though that was a virtual event this year for obvious reasons with COVID-19, there are specific initiatives that target these populations where we're trying to raise funding, and that's really an excellent thing to see. So, that's really where I'll end today. I think that, there's a lot of work to be done, and we hope that the gap doesn't widen in the setting of COVID-19. Interestingly, myself and a couple of other co-authors that are very much involved and very talented with, trying to disseminate the message of health inequities and trying to close the gap there, have recently published a paper entitled "The Impact of COVID-19 on Colorectal Cancer Disparities and the Way Forward." We have recognized that because COVID-19 affects these vulnerable populations at higher rates, and that the same populations that I talk about with colorectal cancer disparities, we really need to put a heavy focus on this patient population. I hope that this video was informative, and thank you so much for your time.
Thank you, Dr. Balzora, and thank you all for joining us today. We are going to switch it up a bit, and we will have an episode of Wellness Wednesday every other week. So join us in 2 weeks for more tips for wellness. Have a great Wednesday.